Welcome. We have seen so far, in homeopathic practice, history taking, physical examination. Then we saw the symptoms, how to rearrange the symptoms to arrive at totality, pathophysiology, general symptom inclusive of mental symptoms, and then last time we consider characteristic particulars also. Next important step, to prescribe is evaluation of symptoms. Evaluation of symptoms means to give value, to put them in the proper place so that the what we call as the patient is perceived as an individual suffering from a specific disease. Individuality of the patient is reflected when we evaluate the symptoms properly and arrive at totality in a particular way. When we start evaluating, one important thing to remember is there has to be a match of that symptoms in the Matra Medica. Suppose if a patient says a particular symptom and that symptom is not recorded in Matra Medica, then it is of no use because we do not know the remedy which is useful in that particular patient. So symptom has to have match in the Matra Medica. This is very important to remember. In day-to-day practice, of course, we use repertory to find out the match, the symptoms which is recorded against a group of remedies. Next is, of course, general symptoms. It may be physical general or it may be mental. As far as whether it is mental, whether it is physical, in fact, whatever symptoms we are considering, it is very important to see its place in the overall anamnesis of the case. There are those things I am telling you. This is the procedure to be followed, but it is to be followed taking into account the case as a whole. That this particular advice we have to remember all the time, that symptom in isolation cannot be considered. It is to be considered in the anamnesis of the whole case. So with these remarks, I will proceed. The 1, 2, 3, 4, the way in which the general symptoms are to be placed. Most important is causative modality. For example, suppose if the patient is suffering, say, from any ailments, he was deeply shocked. So ailments from emotional excitement, that is a causative modality which has given rise to whatever he suffers from. So that becomes very important aspect to be considered. Next is thermal reaction. That means whether the patient is chilly or hot. And that, quite a few, for example, if you take Silicea, it's through and through chilly remedy. If you take fluoric acid, it is just opposite, it is very hot. So chilly and hot may divide the remedies. At the same time, there are remedies which cover both. So depending on that, of course, we have to give value to that symptom. Next is alterations as well as concomitant. What are alterations? For example, in pulsatilla, in drug like pulsatilla, we will find one day the child passes a whitish stool, next day it is greenish stool. So these are all alternative things. For example, they take the remedy like lactaninum. One day the pain is here, the next day the pain is on opposite side. So the direction may change. So the alteration of any sort are very important. Discharges is another thing to be considered. For example, the discharges of Calibacrom are very well known. They are like stingy. It's not only thick, it is stringy. So a specificity of that discharge itself will denote a group of remedies. Effects of physiological processes. For example, eating, drinking, menstruation, these are all physiological processes. But suppose if any complaint is aggravated either before, during or after menstruation, or after eating or before drinking, relationship to a physiological process, that itself becomes an important thing to be considered, and that the value is to be given accordingly. Food factors, though they are of a low grade, aggravation and amelioration by food factors as well as craving and aversion are to be considered when we start evaluating the symptom. Movement, position, these are all what we call as the physical actions in which normally we are engaged with. If any symptom is aggravated or ameliorated before that or after that or during that posture, it is very important. For example, lying down on abdomen is very marked in Medoranum. And there are many symptoms like this. I may not go into details. So the movement, position, they are very important consideration in the evaluation of symptoms. Similarly, physical factors like pressure, warmth, especially if the general condition is aggravated by that, it is very, very important. When you take heat, there may be just simple heat, there may be the sun aggravation. They are all to be differentiated when we consider any symptom in evaluating. Sides of the body, right side, left side, or direction, symptom coming from above downward or going in the diagonal way. So all these, the sides of the body as well as direction, they are very important consideration while evaluating any symptom and its place in the totality. Similarly, general symptoms, say for example numbness or heat sensation in the body, these are very general, affecting the patient as a whole. They also come for consideration in some of the cases when we consider totality and place of such particular symptom in the pathogenesis of the case. Physiognomy, though it is not that important, but yes, in few cases it does help. For example, phosphorus patient, how generally I am telling, he is lean, thin, very delicate, as against calcareous, which is typically described as obese, but very laxity of tissue and all that. So these are all the what we call as external appearance, what we call as a physiognomy. Another important consideration which I already considered is pathophysiology, which provides definitely the location and the type of process, which is very important consideration in the totality and evaluation of symptoms. And lastly, characteristic particulars, which we have seen last time. Now, when the case is before us, there is no, whatever I have told you, there is no rule of thumb. That yes, no, this is general, so this is most important. Yes, important, but ultimately we have to view the whole case, and then you place that symptom in a particular category. In one case it may be characteristic particular which we generally attract our attention, and we see the whole case, and yes, we see that yes, it matches. In another case there may be a general which direct our attention, and then few drugs, and then we select the drug. In another case it may be mental. So these are the pointers to the remedy, and then other symptoms are to be viewed accordingly, and this is how we arrive at totality, the differentiation of this patient to with another patient, and that is very, very important in homeopathy, which is an individualistic treatment. So this is all about totality, an important aspect of homeopathic practice. I will suggest you a few books, especially on what we call a symptom and evaluation. Uh, One, you can just remember Scientific Basis of Homeopathy, published by Association for Research in Homeopathy. You can refer to the written document. You will get the exactly what to refer. I have given the page numbers over there. Second book is Principles and Practice of Homeopathy by M.L.Dhawale and published by Institute of Clinical Research. Third book, that is also very important, especially in evaluation of symptoms. On the comparative value of symptoms in the selection of the remedy by Robert Gibson Miller. If we read the relevant chapters in this book, it is quite sufficient to understand symptoms in homeopathic practice and its evaluation and totality. Next time we'll start our study with of Materia Medica. Thank you.